We have with us the Czar for COVID-19, Mr. Richard Carter. Richard, can you share with us, you would have had experience in other territories, to tell Barbadians why they should not panic for this virus?
My most immediate response would not actually be based on having gone anywhere. It would be simply that panic does not help. Mm-hmm. And in fact, there's evidence that panic actually harms rather than helps. Mm-hmm. But in terms of experience in other countries, I believe one of the reasons why the Prime Minister has asked me to take on this role is that I was on the front line, and I definitely mean on the front line, not simply there, of working with the Ebola epidemic in Sierra Leone. I was there for 4 years. And my responsibility was in social mobilization, behavior change communication, and we provided also support for quarantine, people who were in quarantine, to ensure that they basically were able to comply. The evidence that I have from working in Sierra Leone as a sociologist is that there were loads of consequences of the actions that were taken that fell outside of the narrowly medical. And actually, we saw evidence of serious abuse, teenage pregnancy rates, particularly among school children, almost tripled during the period when children were away from schools. There was heightened evidence of sexual and other types of gender-based violence as a consequence, again, of children being in exposed environments. But more broadly, we saw panic behaviors that actually interfered with our capacity to manage the epidemic. And I think that Barbadians have been distinguished in their history by being disciplined, orderly people. We have seen some evidence over the past couple of days of behavior that has followed what has happened in other metropolitan countries. But if we look at some of the things that have triggered those behaviors, we see at the very same time that you're trying to avoid masses of people in one place, decisions being made to repatriate or causing people to repatriate in huge numbers at the same time. And I've seen photographs of O'Hare International Terminal, for example, with thousands of people crammed together for over 4 hours in an enclosed space, in obviously close physical contact with one another, without any screening or testing, because this is actually before they get to the port health, in an environment which is going to cause the very problems you're seeking to avoid. Mm-hmm. So the long answer to the question is that panic is unhelpful, mm-hmm. and it actually has created instances where we've seen direct damage to our capacity to actually respond. We are currently at stage 1, which means that there have been imported cases. There's no evidence of local transmission. If there becomes, and we suspect it might happen, but if we get to stage 2, which would be a stage characterized by evidence of local transmission, so someone without a travel history getting infected, then obviously the whole picture changes, the whole scenario changes, the response changes. And this is already planned out and plotted out by the emergency operations team in the Ministry of Health and the government of Barbados.
Okay, all right, thank you.